Some people say that you can't reduce the stigma unless you change the way that the systems work. Do you agree with that?
Yeah, I agree completely that one of the main sources of stigma are large psychiatric institutions where patients are put and then no one understands what's really going on. And I always say, if you have been as a patient in a psychiatric institution and you come back to the community, you don't need, and they know it, you don't need any enemies anymore, because it's enough that you are labeled as having been in a psychiatric institution. Okay?
Okay, so one thing is being ill, but the results of the mental illness are even worse, the results of being put away.
Yes. The results, the consequences, is that patients with a normal disease, so to say, with a physical disease, diabetes, they have the problem of the diabetes, of course, but then they are pitied by others. But in mental illness, patients have a second burden. They have to always watch out for stigmatization and discrimination, and they try to be secret about it because they know that society will not react positively to them. So it's an additional burden. Not only you have the disease symptoms and you suffer already from this, if you are depressed, for example, but you also have this additional burden of perhaps hiding it or explaining to other people or withdrawing, and this is a stress, and this may even further your illness.
So human rights can change that, enforcing that? Or
I mean, checking for human rights, and of course in accordance with this, organize community mental health services, so patients or persons with mental disorders can be included in society much more if community services are there.